Hi, I'm Brian Finestein, CEO of St. Clare's Health. I'm here with Dr. Barry Lowell, who's the medical director of our Cath lab, and is going to share with us the new technology that has been brought to St. Clare's. And Dr. Lowell, thank you for inviting us into the Cath lab.
My pleasure. I'm excited to share with you and our viewers the exciting new state-of-the-art technology.
So we're in a brand new lab, and we were talking earlier, and we have a lot of new technology that we're bringing to the forefront. Can you talk about that a little bit, what we're offering our patients now?
Absolutely. For many years, we've been opening arteries from the 1990s on with balloons and then subsequently stents. And we were working under X-ray conditions. Today, our technologies provide us the opportunity to look directly inside the artery and characterize the nature of the blockage. Is it a clot? Is there calcium? Is it just a single blockage, or perhaps several? And using various different technologies, we're able to provide our patients the very safest care, because depending upon what we're up against, so to speak, we may choose one modality versus another. A balloon, a stent, or something of the sort.
Now, I assume those also bring a better outcome for the patient.
They do indeed, and both in the short term and the long term. In the early 90s, we were using balloons to open blood vessels, and these balloons were not as durable a result. And then a small scaffold-like device was developed called a stent. Years and years later, a substance was placed on the stent that made it inert, so that the likelihood of this foreign substance being reacted to by our body was minimized, and the stents became virtually permanent. They never re-narrowed. Today, we place the same types of devices in different vessels, and we're able to see inside the vessel and also determine with many of our technologies what the precise character of the vessel wall may be. So we're able to place our stents more effectively. The stent has a drug on it, and only under conditions where it's touching the blood vessel wall does this drug work. So we can assure, using our technologies, that the results will be durable and the drug will do its job.
Okay. So, the tagline for St. Clare's is around the corner, ahead of the curve. The first part deals with the compassionate care that we provide, and we've got all this new technology, so we're ahead of the curve. And that exists at St. Clare's. Now, a lot of times, this technology is seem to be in vogue for just the large academic medical centers. Is it unusual to have this community type of resource for our patients?
As of this point in time, I can comfortably tell you that we have the absolute best imaging, best technology, and the most high-quality angioplasty catheterization laboratory services available anywhere in the country. We are so proud of this lab, and you've done such a wonderful job bringing us the current state-of-the-art technology. You really have. Not only in terms of the imaging and defining people's anatomy, which blood vessels may be blocked or those, but being able to fully assess all of their blood vessels, not only from an anatomic point of view, but the physiology. That is, how is blood flowing in their blood vessels? So we're proud and honored to be working here.
So we've got all this new technology. On a personal level, which is the coolest?
Oh, well, the ability to see things better than I've ever seen them before. Having worked in this field for 30 years, we've never had imaging the way we do here today. Again, not only in terms of seeing an image of the heart, but able to assess the functionality of the heart.
Okay. One last question, if I might. We've got this new technology, we're bringing it to our patients. Afterwards, we also refer our patients for cardiac rehab. Can you talk about the benefits of that program for our community?
I'm happy to. Let me tell you a little bit more about our perspective of the cardiac rehab program. We kind of think of it as a cardiovascular wellness program. Not only are we treating patients post-heart attack or post-placement of stents, which we do now regularly and commonly for our community, but we are treating patients with heart failure, in cardiac rehabilitation, people with peripheral arterial disease, difficulty walking. And it's more than just a program of exercise. Our nurses are caring, well educated. We teach dietetics, they teach lifestyle change, and it becomes a separate community in and of itself. I might also add that our program here at St. Clare's is perhaps the largest and one of the few programs that offers not only acute cardiac rehab for people who've had a recent incident, but we offer maintenance, which most other programs don't. And it's been a wonderful experience for the patients, and they look forward to coming back and partaking.
Okay. Thank you, Dr. Lowell. It's obvious, it should be obvious to our viewers that Dr. Lowell is very excited about the new technology that has been brought to St. Clare's. And Dr. Lowell, we hope good health and safety for you and your patients, so thank you.
Thanks kindly.
To our viewers, thank you for watching our latest episode of Let's Talk Health. Please look at Facebook and YouTube, as well as our website, stclares.com, for future events.